please welcome nurse Maribel Quinones to the stage.
Hello everybody, my name is Maribel Quinones, soy enfermera, trabajaba por la ciudad hasta el mes pasado. I used to work for the city. I was a public health nurse up until the layoffs last month. And so what I did before was visit pregnant women and babies, and if anybody knows about pregnancy, sometimes some women go through some changes, and you know, not everybody understands the changes that they're going through. So, you know, I've been a nurse for 24 years. I've worked with private, I've worked with public, and I can tell you now that as a public health nurse, I can make a greater impact preventing things than, than being in a hospital treating, these illnesses. But when I used to go visit these women, and they tell you everything was fine, but as you sit there and talk to them, you can't just take, okay, yeah, I'm fine, I'm doing okay. When you sit there and you take your time to talk to them, and the things come out, when you start asking those hard questions, are you doing okay? Are you sleeping? Are you eating? And they're saying, no, I'm eating enough, you're pregnant, you need to nourish these babies. And if you're not feeling well, you're not going to do what you need to do. As a person that visited women in the home, and not just women, even the men in the home, because I did advocate for men also. But when you go to these homes, and you get on the phone and you start calling around for services for mental health, and you're calling 8, 9, 10 different places because there's a waiting list. Our clinical therapists left, our psychiatrists left, and I'm going in a circle trying to find services for people. That's not right, and then I call and I tell my supervisor, and she, you got to find somewhere for her to go. Where is she going to go? I've called the places. I've called the community health centers that are overwhelmed also. Because, you're here making these cuts, but we need more clinics. We don't need less clinics. We need more clinics. Devaya said earlier, you don't have enough, and you're going to cut, and now you're going to have enough. That just doesn't sit well in my head. I don't know how you explain that, but I'm coming to you as a human being, as a nurse. I'm coming to you and I'm asking you, please open your eyes, open your mouth, and be heard. Because if you're not, I can stand here as a nurse and speak for you, but if you don't speak for yourself, all I am is complaining that I don't have a job anymore, and that's not why I'm here. I'm telling you right now, because I get on the phone and I tell people they don't have insurance, they have a medical card, and you know what they say? Oh, we're not taking new clients right now. Call back next month. Well, next month she might not be here. She might be gone, and what am I supposed to do? So when they tell you that closing the clinics is the right thing to do, you guys better start asking, where are we going to go? I want a plan. Before you close these clinics, you need to give me a plan of where I'm going to go. And you know what? Better yet, why don't you get the commissioner's number, the mayor's number,
come on now.
And when you have problems, you can on the phone. Everybody here knows that when things are done, that's it. And if you're not right there, are you going to be able to go to City Hall and talk to him face to face? We can't even get him to come out here today. So how are you going to get through City Hall? How are you going to get to the commissioner? They're not even here now to say, no, these are the things that we have in place. They don't want to hear it. So I'm here to, support you, and I'm asking you, please, open your mouth, start asking questions, and instead of just saying, oh, okay, yeah, this is good for me. Remember everything that they've said in the past is good for us. The parking, how's that working for you guys? Because I'm tired of paying for parking. They cut the nurse, now I can't visit ladies in Pilsen, who are pregnant because, they don't need you anymore. But I'm the one that sat there, when they have these issues, I'm the one that was there. You're not there. All you're looking at is a report. Well, you don't have enough numbers on this report. Well, I'm dealing with human beings, sir. I'm not an accountant. You know, I'm a nurse and I'm dealing with human beings. And so, you know, all I can say is open your mouth and say something and start asking questions and don't take, oh yeah, this is what we have to do. No, there's other things that they can do to find money.
All right.